Good morning. I call this meeting to order. This is the Standing Committee on Community Services. I am the Honourable Susan Corkum-Greek, MLA for Lunenburg, and Chair of this committee. I'd like to welcome everyone back, hoping that you had a peaceful Labor Day weekend. And although I am reminded that technically on the calendar there are still a few weeks of summer, we're now at the second New Year's of the year, heading into September. So happy second New Year's. We are here today to discuss a very, very serious issue for all Nova Scotians and indeed all Canadians. We will hear from presenters today on moving toward an epidemic-level response to intimate partner violence. It's very, very important to acknowledge that calling witnesses here, even for a 2-hour committee meeting, pulls you away somewhat in the middle of your day from the very important and critical work you do. So again, to reiterate right off the start how much we appreciate you being here and how important it is for us as members of the Legislative Assembly to hear directly from you. With that in mind, I will ask everyone to please either turn off your phones or put them on silent. The chair will double check hers 3 times. And in case of an emergency, that we will gather, the marshalling point is at the Art Gallery courtyard. I will now ask committee members to introduce themselves for the record by stating their name and constituency, and we'll begin on my immediate left.
Good morning, I'm Brad McGowan, the MLA for Cole Harbour Dartmouth and Vice Chair of this committee. I want to add my voice by saying thank you for being here to add your voice and your expertise on this very important topic.
Hi everybody and good morning. My name is Damien Stoylov and I'm the MLA for Bedford South. Thank you all for being here.
My name is Diane Timmons. I'm MLA for Victoria Lakes, and thank you for coming here today.
I'm Kyle McQuarrie. I'm the MLA for Inverness, and thank you so much for being here.
Good morning, everyone. Susie Hanson, MLA for Halifax Needham, and thank you so much for being here today.
Hi, everyone. I'm Susan LeBlanc, the MLA for Dartmouth North. I use she, her pronouns. Thank you very much for being here.
Ian Rankin, Timberley Prospect.
Thank you. I would also like to note the presence of Legislative Counsel Aaron Fowler and of our Legislative Clerk Tamer Nusaba. We are now going to ask our witnesses to please introduce yourselves. You will have time for initial introductory comments following this, but for now, if you could please introduce yourself and the organization and work that you do, and we'll begin with Meghan Hansford.
I'm Dr. Meghan Hansford. I use she, her pronouns, and I work with Adsum for Women and Children as a program manager.
Hi, I'm Zhanelle McHugh. I work as the team lead with Adsum for Women and Children.
Good morning, everyone. My name is Cynthia Carroll. I use the pronoun she, her, and I'm the Associate Deputy Minister for the Department of Justice.
Good morning. My name is Nicole Johnson-Morrison. I am one of the Associate Deputy Ministers for the Department of Opportunities and Social Development, and I'm also responsible for the status of women.
Good morning. My name is Emma Halpern. I'm the Executive Director with the Elizabeth Fry Society of Mainland, Nova Scotia, and I also use she, her pronouns.
Good morning. My name is Anne de St. Croix. I'm the Executive Director of the Transition House Association of Nova Scotia, and my pronouns are she, her. Thank you.
Good morning. My name is Marla States, and I'm the Director of Community and Resilience Programs at YWCA.
Good morning. I'm Shannon Pringle. I use she, her pronouns, and I am the Director of Advocacy and Community Response at YWCA Halifax.
Good morning. My name is Lisa Greenough, and I'm the Director with the Gender-Based Violence Division with the Department of Justice.
Thank you for introducing yourselves. It could go without saying, but I think it should be stated. that in the principle of having a frank and forward conversation, that we may be hearing not simply jarring statistics, but individual stories and sensitive information. And I would ask everyone to both prepare themselves for the hearing of that information, but also to reflect with compassion for those sharing those stories. And with that, we'll proceed with introductory remarks, and Dr. Hansford.
Thank you for the opportunity to speak here today and continue on these critical conversations. Gender-based violence in our province is not only a social issue, it's a public health crisis. Rates have risen to epidemic levels, and our response must match the scale of the problem. Treating gender-based violence as the epidemic it is means centering equity, investing in prevention, removing systemic barriers, and funding with the urgency and scale that we bring to other public health crises. By doing so, we not only save lives, but also strengthen the social and economic fabric of our province. First and foremost, an epidemic-level response requires us to prioritize equity, diversity, and inclusion. Violence does not affect all communities equally. Indigenous women, newcomers, 2S LGBTQ+ people, and women with disabilities face disproportionately higher risks. Our strategies and those we invite to conversations such as this today must be tailored, inclusive, and built in partnership with those that are most impacted. Additionally, this lens must reach further than expertise from the traditional sectors, such as women's organizations, shelters, and justice. Although these sectors bring valuable expertise and insight, GBV is pervasive and expands across all sectors and society. It's critical that we think more inclusively and call in key partners in labor, health, education, and others. It is remiss that a representative from the Department of Child and Family Wellbeing is not a witness today on this panel to discuss the impact on children and youth. In moving forward, a priority would be to ensure that agencies who are currently in the stressful and time-consuming loop of applying yearly to receive potential funding from the province must have the security of core funding. The provincial government can no longer lean on nonprofits to shoulder the burden of program expenses on their own. This is a provincial responsibility. Second, we must focus from crisis response to prevention. Evidence shows that early investment in education, community-led supports, and safe housing reduces long-term costs and saves lives. Prevention is not an afterthought or optional. It is the foundation of epidemic control. There's a case study from Alberta that we have included in our briefing note for you, which highlights the cost analysis of moving the target of the work to prevention, albeit it is a bit dated and from a different province, but the formula and analysis are still very much relevant. Thirdly, we must break down the bureaucratic barriers that delay urgent action. Survivors often face complex and fragmented systems, which creates traumatization and lost opportunities for safety. Streamlined cross-departmental collaboration within health, justice, housing, and social services will ensure a coordinated response. Finally, funding decisions should be based on epidemic-level case studies. And again, in our briefing note, we provided some examples for further reading for you to look over. When our government confronted COVID-19, extraordinary funding was mobilized quickly, reflecting the urgency of saving lives. Gender-based violence demands the same approach. Funding at a scale proportional to the human and economic costs, backed by transparent outcome measures. My colleague Zhanelle is going to take some time to unpack this a little bit more into some digestible points and examples. Thank you very much.
I'll turn on my mic and recognize Zhanelle McHugh.
While we look forward to creating an epidemic-level response towards intimate partner and gender-based violence, we have to understand the fiscal responsibility that we have. Justice Canada estimated in 2009, intimate partner violence cost Canada $7.6 billion, and in Nova Scotia it was $237 million due to inaction. The inflation adjustment is around $10.6 billion and $341 $1.5 million in Nova Scotia. While we take the understanding of what inaction costs, we also need to think about how we move forward in order to be at an epidemic level response. There are 3 categories that can be implemented within Nova Scotia based on the population. A basic level stabilization includes a baseline of keeping shelters open, crisis lines active, and a very minimal prevention. When we look at the benchmark comparison, that's equivalent to the COVID-19 gender-based violence response funding, designating $8 per person. A basic level implementation would cost $8.6 million annually for Nova Scotia. When we're looking at a transformative model, and in comparison, we can look at Australia, which implemented a national epidemic level full crisis response to intimate partner violence, designating $180 per person. This looks like new shelter infrastructure, extensive education in schools, greater access and transportation in rural areas, and intensive perpetrator programs, equating to $194 million annual investment cost. When we are considering an epidemic level response, that looks like province-wide 24/7 crisis housing, counseling access, GBV specialized courts, prevention in schools, equity-led programs, and real-time outcome reporting. The annual investment is $108 million, which equates to $100 per person. As always, when we're thinking about the cost of putting towards an epidemic level response to intimate partner violence, we also must acknowledge within an equity lens. Nova Scotia already contributes $500,000 per year for African Nova Scotians and MICMA partners as a reminder that our individuals who are people of color, Indigenous, immigrants, those with disabilities, and a part of the two-spirited LGBTQI+ experience violence at a disproportional rate. While we're looking at an epidemic response, we need to ensure that we are using inclusionary measures to intimate partners, gender-based violence, and familial violence at an epidemic level. Designing a definition for the epidemic level response and establishing a benchmark in comparisons to other healthcare emergencies, ensuring that the bureaucracy is not limiting and or creating barriers to urgent responses. While creating a minimal service standard for prevention, crisis response, legal supports, housing, and survival care, making sure an epidemic level response is not just rhetoric, but is tied to measurable service. We need to adopt an epidemic level package core funding of $108 million, including establishing a GBV auditor working with an engagement table for cross-department coordination and accountability, and establish reporting and evaluation systems to track our outcomes. It makes good fiscal sense to implement an epidemic level response as the cost of inaction is more than double the investment approach. This not only saves lives and advances equity, but strengthens the social and economic fabric of Nova Scotia.
Thank you. I would now ask Associate Deputy Cynthia Carroll, please.
Thank you, Madam Chair, members of the committee, and fellow witnesses. It's a privilege for me to be here today to discuss this profoundly harmful and deeply rooted issue in our communities. Addressing gender-based violence requires sustained, coordinated action and a shared commitment to creating safer communities for all Nova Scotians. Since declaring gender-based violence an epidemic last fall, government has taken significant steps to strengthen programs, expand services, and launch new initiatives. Our approach to preventing and addressing this issue is broad and comprehensive, reflecting both the urgency of the problem and our determination to respond effectively. We are listening, we are learning and collaborating across government and with community, and we are acting together to prevent violence and support those it harms. When I appeared before the Standing Committee on Health in May to talk about this important topic, I spoke about the need for government-wide approach and the importance of working in partnership with survivors, advocates, and with communities. Since then, we have taken important steps forward on several fronts. The vision of the Gender-Based Violence Division that Minister Drouin described in early 2025 is now more fully developed. This division works across government, bringing together expertise, leadership, and focus to strengthen our prevention and response efforts. Today, I'm pleased to say that we are joined by the division's first executive director, Cheris Payne, who started in her role just this morning and is with us in the gallery today. Welcome, Cheris. Cheris served most recently as the Director of Legal Services for the Family Law and Child Welfare Division of the African Nova Scotian Justice Institute. She brings a wealth of experience in legal practice, strategic leadership, and community engagement, along with strong commitment to advancing equity and supporting survivors. I know she'll be a tremendous asset in our efforts to prevent gender-based violence and help those it harms. Under Cheris's leadership, the Gender-Based Violence Division will advance a comprehensive approach that spans both prevention and support for victims and survivors. It will take on the important work of reimagining and reinvigorating activities and initiatives that have been established in the past, but which may have struggled to make sustained progress. By bringing these mandates together under one coordinated division, we can ensure greater momentum, alignment, and impact in advancing our collective efforts. The division will also facilitate the work of the Ministers' Table on Gender-Based Violence, which will bring together government leaders, service providers, advocates, survivors, and others with lived experience. This table will provide the insight, advice, and perspectives we need to ensure our work is informed, focused, and responsive. Applications for the table are still open, but already we have received a robust response from across the province, a clear sign of the commitment and willingness of Nova Scotians to be part of the solution. Forums like the Ministers' Table and conversations like those that we will have today are critically important. They give us the chance to listen, a chance to learn, and to identify where we can do more and do better. They ensure that the voices from across the province help shape how we move forward, grounding our work in the real experiences and needs of those most affected. In fact, it was at an earlier standing committee meeting that we heard a very important concern. We heard clearly that continuing to use the Desmond family name in connection with this tragedy has caused further pain and re-traumatization. We recognize and are committed to correcting this. Supported by the judiciary, the Office of Equity and Anti-Racism, and informed by members of the family, we are actively working with our government and justice partners to make sure our words and efforts don't intentionally cause any more harm. These are some of the tangible changes that reflect our vision to deliver collaboratively a government-wide and whole-of-society trauma-informed response to gender-based violence. We know that lasting progress requires listening and learning, partnership, and action. In the past few months, we have deepened our connections with community, strengthened our structures for collaboration, and reinforced our capacity to support victims and survivors and hold offenders accountable. This work is urgent and is ongoing. We are building on momentum, learning from those most affected, and taking deliberate steps towards safer communities for all Nova Scotia. I look forward to your questions and to hearing perspectives and continuing this important work together. Thank you.
Thank you. And I would call on Associate Deputy Nicole Johnson-Morrison, please.
Thank you, Madam Chair, and thank you to the members of the committee. I appreciate this opportunity to join with the other witnesses here today to talk about this very important issue. We know that intimate partner violence is an epidemic in our province, and it continues to impact far too many Nova Scotians. Declaring it as such was a critical first step in acknowledging the scope and the seriousness of the issue. And I remind that Nova Scotia was the first jurisdiction in Canada to acknowledge that intimate partner violence is an epidemic. And this is why we're working across government and with our partners in the sector who are here today at the tables with me, and with law enforcement and with communities to advance the recommendations, both of the MCC and the DFI final reports, to end gender-based violence in Nova Scotia. My colleague mentioned about the establishment of the Minister's Table on gender-based violence. I'm pleased to say that the Minister of Status of Women is also co-lead on that table, along with Minister Drouin. And this table is established to really hear directly from the sector, from the experts, many of who are here with me today, and from Frontline and lived experience about what they see at a community level and what they have experienced personally. Because we know that when we listen to those doing the work and those living with the realities, we can better tailor and identify where we need to focus our efforts to ensure that we're making real, lasting change for victims, for survivors, and for communities. We talk a lot about the need for greater funding, and it is true. Funding is an important part of this conversation, and it needs to be coordinated, and resources need to make the impact that will make the greatest difference in Nova Scotia. We're showing up in a new way, though. This isn't just a women's issue. It is a societal issue, and we need to come together as a society to ensure that we are wrapping arms around this issue to solve it. We're seeing progress. In government departments across the entire province are stepping up to support and help. We're seeing community organizations that are collaborating and sharing resources, and we're seeing more people with lived experiences coming forward to share their experience. The commitment is more than just words and money. It is in our action, and that includes more than $100 million across government to support initiatives that address gender-based violence. It is in the increased funding for our partners in the sector, including a new $17.9 million over 4 years for the transition houses, $3 million over 3 years to support the YWCA. It's a $5.8 million support for gender-based projects across the province through the National Action Plan. It's the changes to our labor code, which were announced earlier this year, which now provides up to 5 days of paid domestic violence leave for victims or survivors of gender-based violence. It is in the gender-based violence housing benefit, which provides housing support for up to 2 years for those who are fleeing gender-based violence and domestic violence situations. It's also in the curriculum that's under development within our schools to ensure that programs that kids are exposed to really have a gender-based violence lens. And it's things like Guys Work, a prevention and early intervention program for men and boys that is now a permanent program in all our public schools. We are encouraging women to consider careers in STEM and to run for elected office because we know that women's economic security and their voices is important. And preventing gender-based violence is at the root of this. We are incredibly fortunate in this province to have organizations like the advocates who join me today on the panel to help guide us in these conversations. And we're committed to listening, we're committed to learning, and we're committed to making sure that the voices of those who are marginalized are lifted up. I really appreciate the opportunity to share a little bit more about the work that we're doing at the Office of the Status of Women, as well as the areas that are important to the conversation today. And I hope to hear from my colleagues where we might actually be able to continue to support and advance efforts. Thank you.
Thank you. We will now hear from Emma Halpern, ED for the Elizabeth Fry Society of Mainland, Nova Scotia.
Thank you for the opportunity to be here today. I want to start by seconding the comments of my friends from Adsum, in particular the comments related to the desperate need for core funding, as well as the need for this to be an issue that's looked at across government departments and silos. At Elizabeth Fry Society, we work at the intersection of victimization and criminalization. This allows us to see how gender-based violence impacts every aspect of someone's life. The vulnerability of our clients makes them a lot more likely to be charged criminally than to access services for their experiences of trauma and abuse. This is because our clients are predominantly from African, Nova Scotian, and Indigenous backgrounds. An overwhelming number of our clients grew up in child protection services. Our clients are members of the 2S LGBTQ community, and perhaps most significantly, almost every one of our clients has lived in very significant poverty. We see the way in which gender-based violence impacts employment. It impacts, as I said, it impacts criminalization, which can cause someone to get a criminal record, and then a criminal record can keep you in a domestic violence relationship. We require programs that go beyond programs just simply for domestic violence, but programs that actually meet folks' needs as it relates to employment, as it relates to housing, as it relates to getting rid of criminal records. And this year, our experience of gender-based violence moved from the professional into the personal. 3 of our staff were impacted personally. We had 1 staff whose cousin was killed, 1 staff whose aunt was killed, and then 1 staff who herself was shot by a domestic partner. The experience of our staff who was shot by her partner was eye-opening even to those of us who work in this sector. It showed us the massive gaps in our systems, the ways in which, despite great efforts at policy changes and so on, we don't have the ability to be nimble, to move quickly, to address needs as they come up in the moment. My staff were the ones at the home after there were shots fired, cleaning up the blood. My staff were the ones boarding up the windows of that home to make sure that nobody came in from off the street. We saw gaps in medical services. We purchased the boots that our staff had to wear when she had been shot in the legs because her insurance didn't cover it. We found her housing because there wasn't time to access the housing benefit to get her into new housing. And most importantly, perhaps, there were no culturally appropriate services. Our staff very troublingly said, I am my own caseworker, because she herself, her role was African Nova Scotian domestic violence caseworker, and the only one in the province. So she had been shot and had to then do the work to support herself. This is all the more concerning given the incoming cuts at the federal level. We're all aware that those cuts are coming down with the budget. We are going to see cuts to many of our programs funded at the federal level, and one I want to draw particular attention to is a massive program to get pardons for women and gender diverse folks in our province that is going to be cut in April of this year. I have many instances of women who have come forward to say because of their criminal record, they cannot move up in their career, and because of that, they are stuck in violent relationships. This is a deep concern and an area that we need to address. It demonstrates that need for us to be able to work across silos. This is about employment, this is about housing, this is about a quality of life that all of Nova Scotians deserve.
I'm taking a just 30-second pause because there was some pretty powerful information shared there. We'll now hear from Anne de St. Croix, Executive Director of THANS, please.
Good morning, and thank you for the opportunity to speak today. I want to begin by acknowledging the chair, the Honorable Susan Corkum-Greek, the members of the Standing Committee that are here today, and the esteemed guests and experts joining us. As I mentioned, I'm the Executive Director of the Transition House Association of Nova Scotia. We are an umbrella association of 14 violence against women organizations across the province. So together, our member organizations provide essential services to women and their families experiencing or at risk of experiencing violence. Our members offer far more than just a bed, which is a common misconception. They answer crisis calls at all hours, help survivors create safety plans, provide counseling, accompany people to court, advocate with systems, and connect families to the resources they need. They are there in moments of crisis, and they walk alongside survivors as they try to rebuild their lives. Last year was one of both tragedy and resilience here in Nova Scotia. Our member organizations supported more than 8,000 people in 2024. Just over 2,000 of them stayed in emergency shelters. That includes 643 children. Staff also answered more than 5,200 calls and requests for help, which works out to be about 14 every single day. We know that this is just the tip of the iceberg. At the same time, we lost far too many lives. As we all know, between June 2024 and March 2025, there were 10 femicides in Nova Scotia, along with 1 intimate partner homicide and 7 related deaths. These numbers represent women and families whose lives were cut short and communities forever changed. In September 2024, the government declared intimate partner violence an epidemic, and that was an important step. But treating this like the epidemic it is requires more than recognition. It means coordinated action and real investment. It also means stabilizing the very people who are already doing the work on the ground. We recently surveyed staff across our network to identify gaps in services across the province. Even in draft form, one message is clear. Workloads are beyond a sustainable level. In urban centers, workers juggle several active cases at once while new crises arrive daily. In rural communities, the strain is the same, and staff are often asked to step in where no other services exist. That stretches the time they can spend with each person and makes it harder to respond as quickly as people need. Staff also told us that the lack of housing, healthcare, and transportation is one of the biggest barriers survivors face. Without these basic services, it becomes harder for women and families to find safety and stability, and transition houses are left trying to bridge the gap. And the toll is heavy. 65% of staff described their workload as heavy or very heavy. 2/3 said the stress of the work carries over into their own homes and personal lives. Despite this, staff continue to show up every day with compassion and commitment. They do everything they can to make sure survivors feel heard, respected, and supported. They are the human foundation of our epidemic response. But when responders are stretched too thin or pushed to the point of burnout, it is survivors who feel the impact. It means longer wait for beds, less time for counseling, or fewer options for safe housing. It means that families in crisis can't always get the support they need when they need it. And when that happens, it isn't only survivors who are at risk. The safety and well-being of communities across Nova Scotia are at risk too. We would never expect doctors or nurses to respond to a public health emergency without the proper tools, fair pay, or supports for their own health. We should not ask it of those responding to intimate partner violence either. If we are serious about treating intimate partner violence as an epidemic, we must take the following actions: stabilizing the frontline response, investing in prevention and culture change, and expanding supports for men who cause harm. Thank you, and I look forward to continuing today's discussion.
Thank you. I'll now ask to hear from Marla States, Director of Programs for the YWCA Halifax.
Thank you very much for having me here today. I stand before you as a director of supporting the Violence to Resilience team at the YWCA. I'm also a descendant of Africville and the Preston Township communities that have long been at the heart of the African Nova Scotian resilience and strength. Yet these communities have borne the weight of systemic racism, displacement, and marginalized experiences that continue to present in our lives. Africville was once a vibrant Black community in Halifax, which was forcibly displaced in the 1960s, leaving behind a legacy of trauma and loss. Similarly, Preston Township, encompassing North Preston, East Preston, Cherrybrook, and Lake Loon, hold the distinction of having the highest percentage of Black residents in any area in Nova Scotia. These communities were established by those seeking freedom and a place to call home. Yet despite their deep history and contributions, they have faced persistent challenges, including limited access to resources, services, and supports. African Nova Scotian women in these communities, after displacement, experienced intimate partner violence at undisclosed rates and still do, with the most impacting incident taking place on December 31st. Historically, African Nova Scotian communities are far less likely to report incidents and far more likely to face the obstacles in assessing culturally safe supports. This violence is compounded by systemic barriers of poverty, racism, cultural stigmas, and mistrust of institutions. These are not isolated instances, they are signs that demand urgent attention. While I commend the province on declaring intimate partner violence an epidemic, if this were an infectious disease spreading through our communities, we would not hesitate to act. We would mobilize resources, coordinate sectors, track patterns, and prioritize prevention and care. Intimate partner violence deserves the same epidemic-level response, especially here in HRM, where the scars of Africville and the Preston Township reminds us that historical trauma amplifies vulnerability. An effective response requires leadership from within the African Nova Scotian community, investment in culturally safe services, prevention, education, housing, and systemic accountability. It requires collaboration across healthcare, justice, social services, and community organizations to prevent violence before it starts and dismantle structures that allow it to persist. As a director of community and resilience programs, I am overjoyed to hear of the release of the Minister's Table on Gender-Based Violence. and I patiently await the opportunity to be a part of this, to be a voice that represents Preston Township communities to support survivors. As I currently am the Director of Community and Resilience Programs, I support the Violence to Resilience programs of Safer Spaces, the End Stay program, and our December 6th program. The history of African Nova Scotian communities is a call to action. It reminds us that injustice, when ignored, compounds over generations. Let us confront intimate partner violence with the same urgency and coordination we bring to any public health emergency. And let us honor our African Nova Scotian communities by ensuring that safety, healing, support are not just privileges, but they are rights.
Thank you. And now I'd like to hear from Shannon Pringle, Director of Advocacy and Community Response for the YWCA Halifax.
Good morning, and thank you very much for having me today. It's a great opportunity. I consider it a great privilege to be here. I shall focus my comments today on people who are often let out of the conversations of intimate partner violence. And those people are people with disabilities. Visible, invisible, permanent, and episodic. And also people who are disabled during acts of intimate partner violence through traumatic brain injury, strangulation, spinal and thoracic injuries. 37.9% of Nova Scotians have one or more disabilities, and is the highest rate of disability in the country. People with disabilities are more likely to be victimized in their own home, with close to 30% of violent incidents against a person with a disability occurring in their private residence. Now, turning to people who are disabled during the acts of intimate partner violence, it is estimated that 230,000 Canadian women suffer a violent physical attack at the hands of an intimate partner each year. And as many as 92% of them report symptoms consistent with brain injury. Now, most of us are probably familiar with brain injury in the context of NHL hockey players who take a blow to the head, are benched for life, and lose their careers. But we don't think of brain injury so much in terms of intimate partner violence. And I'm hoping to change that conversation. People who are strangled, choked, take blows to the head, face, and neck, violently shaken, thrown downstairs, thrown against walls, thrown against moving vehicles, face permanent disability. For many people with disabilities who are unable to participate in full-time workforce, the only choice they have is just to rely on income assistance. In the year 2000, an unattached single person with a disability received income of $14,861 a year, in which they were to pay shelter, food, clothing, fuel, utilities, and personal items. I assure you that in 2000, this level of income constituted deep income poverty. 25 years later, a housing crisis, an affordability crisis, and inflation, an unattached single person with a disability in 2025 on income assistance receives $15,117 a year. Income assistance rates constitute deep income poverty in 2000, and in 2025, the situation is even worse. In 2000, you could possibly get an apartment for $400 to $500, a studio apartment. In 2025, you're living in a shelter, or perhaps on the street. All parties have formed government in the last 25 years in this province, and yet the change in economic support for people with disabilities between 2000 and 2025 is minuscule. In fact, if you look at the history of income assistance over the last 25 years, you will see that support from income rates in 2000 actually declined to as low as $12,151 a year in 2019. This is not opportunity, and it is not social development. It demonstrates economic contempt for people with disabilities and a race to the bottom. Combined with the heinous social policy of clawing back additional income that people with disabilities may receive, income assistance leaves no way out for people with disabilities. It leaves no exit strategy for people with disabilities who are victimized by intimate partner violence, and it leaves no exit strategy for anyone sustaining brain injuries and disability with intimate partner violence. Anyone at any time can be disabled with circumstances beyond their control. Car accidents, a serious viral infection, as we saw with COVID-19, with 3.5 million people across the country experiencing disability from the effects of COVID-19. Severe heart disease, cancer, multiple sclerosis, and a host of other conditions. But I have hope. So as this province harnesses the offshore wind, extracts gold and critical minerals from the earth, and drives new markets and economic expansion in ways that we have not seen since World War II, I have great expectations that we economically level up with people with disabilities, seniors, and anyone fleeing intimate partner violence or circumstances beyond their control, and provide them with the adequate income support they need to thrive. Thank you very much.
Thank you to all our witnesses. Speaking personally, which I'm not sure as chair I'm supposed to, but I'm going to anyway. Some of the most impactful collection of introductory comments that I have personally ever taken in. We do want to get into questions, and I will just remind everyone just to wait until you're acknowledged by the chair. So the red light on your microphone will be the signal that you've been acknowledged, and that is so we have a good record through Ledge Television and other resources. But with no further delay, we're going to begin with questions for 20 minutes by the NDP Caucus, and I would recognize MLA Susan LeBlanc.
Thank you very much, Madam Chair, and thank you all for being here. I don't want to take up too much time, but I will just acknowledge your deep expertise and commitment in these issues, not this issue. And I'm deeply grateful that you're here taking the time, as the chair said, out of your incredibly important work to answer some questions or to teach us. My first question is for Associate Deputy Johnson-Morrison. It's becoming harder and harder, as we've heard and we know, for survivors who need to leave to find safe space. Last spring, Dr. Hansford said that when a spot opened up in one of Adsum's programs, they had 6 families waiting for it, adding that it was, quote, an impossible decision to try to see who was going to get that bed, end quote. So what is the department or the Advisory Council on the Status of Women, what are you doing to ensure that there is space for every family that needs it when escaping violence?
I recognize AD Johnson-Morrison.
Thank you for the question. I think when it comes to where we actually have supports across the entirety of the province, we have provided additional funding for all of the transition houses that they can actually focus on ensuring that there's space for everyone that is looking for a bed. In instances where a transition house might be in a space where someone is escaping violence and they're unable to be housed, there is an entire system that exists, and I know my colleagues here will also be able to speak to that, whereby they can ask another transition house to take that person, and in instances where that's not possible, there's also the option to support them in a short term in a facility like a hotel or something that allows for them to be safe. We also have, when it comes to the supportive housing network, so how it typically works, we'd have transition houses, but then we also have supportive housing across the province, and there are numerous people at this table, actually, that are supporting that network of supportive housing so that anyone that's escaping a violent situation can actually be housed in either a transition house or then they can move on to being in one of the supportive housing units. And we have, when it comes to ability to actually support people, the Canada-Nova Scotia Housing Benefit on Gender-Based Violence actually provides funding through the Department of Economic Development to support people to actually access funding, and it can be turned around in as little as 24 to 48 hours so that they can actually get that funding to support themselves if it is that there's need for them to take their families out of a dangerous situation. So they're a myriad of different services that are available, whether it's a transition house, whether it's supportive housing, or whether it's associations like the Canada-Nova Scotia Housing, well, it's not an association, I correct myself. It's essentially a program that actually helps people to be able to get out of a situation if they need to. And I would be remiss if I don't also speak to the December 6th Fund, which is one that provides emergency grant funding to anyone that's fleeing domestic violence that can actually access that fund through the YWCA, and that was funding that was provided just this spring to the YWCA to ensure that they are able to provide funding depending on how someone feels like they might need to use that funding. Thank you.
I recognize MLA LeBlanc.
Thank you. Is data being collected on shelter and transition house occupancy rates? Because what you're saying does fly in the face of what we heard from Dr. Hansford last year. I understand that there is a network, but we also know that that's being maxed out. So I have two follow-ups on this. So number one, is data being collected on shelter and transition house occupancy rates? And how often are shelters and transition homes operating at maximum capacity based on that data?
I recognize AD Johnson-Morrison.
Thank you for the question. So you would I think you would understand and be appreciative of the fact that the collection of data is quite complex. These are people that are looking to get out of a situation that might not necessarily want the entirety of that scenario to be public. So the data that is collected based on what it is that the transition houses would actually like for us to know. We respect their ability to tell us what it is that they can actually report on that does not breach privacy. And when it comes to the ability for that data to be brought to the department, we actually collect data points that the transition houses provide to us that they think is necessary to tell us where there might actually be a specific need. One thing I would say is we are not getting reports from transition houses on a regular basis at all that there are issues when it comes to them not having capacity. In the event that they do, our office is contacted and we find solutions. And we are constantly in conversations with the transition houses to ensure that where there's need for additional capacity, that we're finding solutions. There are different things that we can do, as I said, different mixes. If, for example, there's not another transition house that can take someone, there's other opportunities for us to provide funding. And I would say that, you know, we would welcome any opportunity to have a conversation with transition houses where there's capacity needs, because the safety of Nova Scotians is a priority. So it doesn't matter what it is that the complexity of the issue, we will find a way to work with the transition houses or with the women's shelters or with any other partners to make sure that people are safe first and foremost.
I recognize MLA LeBlanc.
Thank you, Madam Chair. And totally acknowledging that data obviously can't breach privacy issues, but should be being collected so that we know the problem we're actually facing. And so it sounds like you do receive data, and so I'd ask the department to please, or the office to please table it in writing with the committee after the committee, and that includes the data that you're collecting, and also the data on maximum capacity. So you mentioned, if a transition house is, if Transition House Association is maxed out, how often you're required to pay for hotels or alternate places for people to stay. That would be great. Thank you. My second question is for Adsum House. The average rent for a 3-bedroom unit in Nova Scotia, and wait for it, because I think this is probably somewhat outdated data, is $2,000, over $2,000. We all know that it's probably higher in many places. And so single parents trying to find a place to live with their children cannot afford such high rents, obviously. Can you tell us how hard it is for a single person to find an affordable place to live, including with children? So that's for either of the folks from Adsum.
I recognize Zhanelle McHugh.
So there are many factors when it comes into trying to find housing, especially for single mothers, is that there's a lot of discrimination, especially when it comes to individuals who are people of color, immigrants, part of the LGBTQ plus community. And because of the cost, that it is very hard to find someone who can especially rent to someone on a single income. As we know, the salary rate for Nova Scotians at this time is at a rate that does not support the amount that apartments cost. And so when we are actually looking for housing for individuals, we always have to look at what we can do to possibly have them be housed, which is looking at subsidies in order to provide housing. So it does become very difficult depending on obviously the situation where someone wants to live in, especially when they're expressing that they need to find somewhere that's safe. Oftentimes those safe spaces where they need to be closer to hospitals or to work, so that way they are maybe being provided transportation, once again for safety reasons, that it needs to be in a core area where it costs exponentially at most.
I recognize MLA LeBlanc.
Thank you, Madam Chair. The province's housing needs assessment found that more than 21,000 units with at least 3 bedrooms would be needed by 2027. And again, those are units with 3 bedrooms, but they also need to be affordable in some way. Can one of you speak to what you're seeing on the ground right now? Is the province investing in building enough multi-bedroom units that people can afford to live in?
I recognize Dr. Hansford.
I appreciate the question because it's one that we've been having as an organization and with other organizations in community as well. As we are looking around, there was just an apartment building that was historically affordable in North End Dartmouth on Pinecrest that was recently bought and flipped, is beautiful and extortionately high, and then also pushes all of those people in the neighborhood, including vulnerable families and folks that we're talking about today, out of that community, and it becomes impossible. And that is happening over and over and over across historically affordable neighborhoods. And I think this conversation also comes back to, if I can, around funding, and to provide some context around core funding. Just to start, transition houses and shelters are separate entities. So Adsum House does not receive the same funding that transition houses have. So those are 2 separate spaces, just to kind of clarify there. But to provide some context, some of Adsum's own funding deficits from last year include over $550,000 for our own shelter, Adsum House, $90,000 for the Sunflower, which is one of our permanent housing sites, $10,000 for our master lease program for families experiencing gender-based violence and homelessness. And underfunding will be even higher this current year. So I think when we're looking at core funding and we're looking at creating affordable housing stock, we really need to be providing agencies like Adsum's and others the core funding, because we are currently in the process of building more. We've got 2 projects right now underway, and in order for us to keep these building products and to sustain and purchase more affordable housing so that it doesn't go into the private market and become unattainable, we need support to be able to make that happen, because right now agencies like Adsum are not receiving the funding that we can to keep deeply affordable rents. And we can't go to the bank and get a mortgage for X amount if we're only showing on record that these are the amounts. But these are the amounts that people can pay, these are the amounts that people can afford, and those options are becoming less and less. So it is hard, but it could be a fix for sure.
I recognize MLA LeBlanc.
Thank you for that. So I guess I'm going to move on to Transition House Association. Nova Scotians are struggling more than ever to find affordable homes. The Houston government's inaction on building homes people can actually afford, and their inaction to protect renters is leaving people stuck. And we know this. You've all been talking about it. And that means it's even harder for survivors of gender-based violence to leave bad situations. So what are your members, Ms. de St. Croix, what are your members telling you about the housing need, and how has it changed over the last couple of years?
I recognize Ms. de St. Croix.
Thank you for the question. I just want to very briefly return to a conversation that was had earlier, just to make a distinction that a transition house is not housing. So a transition house is meant to be a temporary emergency response to someone experiencing violence. It's not meant to be a long-term housing solution. So I think when we're talking about shelter and transition houses and housing, those are two distinct things. And I think another point that I would like to make is that the housing crisis is not exclusively an urban issue either. What we're hearing from our frontline members is that it's just as difficult to get housing in Sydney or Port Hawkesbury or Yarmouth as it is here in Halifax. I think what we're hearing as well from our members is people aren't leaving abusive relationships because they know there's not going to be housing for them. They know that the shelters are operating at capacity, and I can confirm that we do collect data on occupancy rates. I don't have them in front of me. What I can anecdotally share is that we're operating at capacity almost all the time. And so when someone isn't able to be accommodated at a shelter, let's say here in HRM, typically what we would do is try to offer shelter elsewhere in the province, even though that's not ideal, taking someone out of their community to receive resources. We can't even necessarily do that anymore because our shelters outside of HRM are also at capacity. So I think as far as investing in housing, one thing that we need to do is invest in second stage housing across the province. This is longer term housing at affordable rental rates that are still attached to our organizations. This alleviates the pressure on the shelters and allows us to move women out of that temporary crisis response and into that longer term solution housing. I will also say, to my knowledge, we don't receive funding to manage those second stage housing units. So that falls on the shoulders of our member organizations. Again, anecdotally, our executive directors are essentially also acting as landlords. If there's a toilet that's clogged at a second stage shelter or a second stage unit, our executive directors are the ones that get the call and go respond to that. So there needs to be funding attached to the management of second stage housing across the province as well. And there needs to be more investment in affordable housing, not only in urban centers, but across the province too. Thank you.
I recognize MLA LeBlanc with about 4.5 minutes left.
Okay, thank you very much. I actually was going to just ask about second stage housing, so thank you for that. I will skip on because we have very little time to talk about a lot of important things. This spring, two of my constituents struggled to access the survivors of gender-based violence rent supplement. Associate Deputy Johnson-Morrison, you referred to that supplement earlier, and they struggled to access it because of unnecessary bureaucratic barriers. They were left waiting for weeks in very precarious situations, and to know that you can turn that around in 24 to 48 hours is not been my office's experience. So. Good to know. So with those situations, they were ultimately resolved positively, and those folks are getting the benefit now. But these kinds of bureaucratic barriers should never have been in the way of the survivors getting the help they need. So are you confident that these kinds of barriers for the survivors of gender-based violence have been removed across government departments?
I recognize Associate Deputy Johnson-Morrison.
Thank you for the question. So what I can say is one of the main things that we have done and we continue to do differently is to ensure that all departments are sitting around together to discuss issues. So this was formed after the two inquiries, the DFI and the MCC, and collectively, associate deputy ministers from across all of government collectively sit down and discuss issues that might have disproportionate impacts on issues when it came to something to do with an outcome from one of the inquiries. And one of these pieces of the work that we are also included in the discussions is also ensuring that we talk about issues when it comes to things like housing. The Canada-Nova Scotia gender-based violence benefit was not developed in isolation. It was one of those pieces where hearing from what it is we have gotten from the sector, that would have been shared with the Department of Growth and Development to ensure that we are sharing what is the real-time information that we've heard from the sector to ensure that when that program is developed and other programs like that, it really does reflect a collaborative, coordinated approach. So to answer your question, it really is not something that we're doing in isolation at all. It is reflecting the opportunities to really integrate the system to ensure that we're being as cohesive and as collaborative as possible. And just this summer, our office, as well as the minister responsible for status of women, was out visiting all of the partners, whether it's women's shelters, whether it's transition houses and others, to hear from them so that when we are thinking about making any changes to the system, it really does reflect the first voice, lived experience of the people that are doing this work on the front lines. Thank you.
I recognize MLA LeBlanc with a little over 1 minute.
Thank you, and I'll just turn to transition houses for that question about my understanding is that when people are applying for that benefit, they need a referral from an organization, and so I'm wondering what barriers you have seen or what your members have seen from your side of the program. Thank you.
I recognize Ms. Dusain-Croix, please.
Thank you. I'll speak very quickly. I think generally what we're hearing is the lack of information and also competing information. So there have been some guidelines within the program that were changed. That information wasn't, I think, properly shared with the public. So there's some confusion around eligibility, confusion around how to apply, whether you need that referral agency. There were also referral agencies added to the list. Again, I don't think that information was really efficiently shared. So there's some misinformation around who is an eligible referral organization. So I think just the bureaucratic paperwork and process surrounding the application still remains a barrier.
Your sense of timing is really extraordinary. I'll have to get coaching from you. We'll move on quickly to the Liberal Party's time, and I would recognize MLA Rankin.
Thank you, Madam Chair, and thank you to everyone for coming here. Really appreciate all of your work. It's really meaningful work, and it's certainly invaluable to Nova Scotians across the province. And I want to thank Adsum House for sending in the proposal around some targeted items in the briefing note this morning. And something that caught my eye, especially with the conversation we've already had this morning around 24/7 access to crisis housing and tracking the outcomes. And I just find it odd that why we aren't tracking something so valuable, given that we all see this as an epidemic, and I think everybody in the room sees that, but the Associate Deputy talked a lot about how there's a myriad of programs and that people can access all these different things, but yet we're hearing that shelters are full or operating at capacity. So I'll start by asking our service providers, do Nova Scotians have safe access to housing when they need it 24/7? If there are people that are trying to escape intimate partner violence, or if they're in a troubled situation where that could be happening soon, do they have access to that housing that they need? And if not, what barriers are there? And I see there was a lot of writing when government officials were talking about all this access, especially to our service providers, Ms. St. Croix, Ms. Halpern, and I don't think Ms. Halpern had a chance to answer the previous round. So maybe I'll start with service providers. So I think that's a really important question today.
Am I correct to recognize Ms. Halpern?
Yes.
I did want to raise a couple of things that hadn't come up already, so thank you for that opportunity. The first is that if you are a survivor of domestic violence and you have children, the first line of response generally comes from Child Protective Services. And I gave an example with her blessing, my staff who went through this, so I went through it very intimately with her. And before anyone had phoned her in the hospital, it was Child Protective Services who got a hold of her, before Victim Services, before anyone, before the police. And we're very clear that her children were going to be removed until such time as she had appropriate housing for them. The violence she experienced was in her home. Her home had been destroyed. And so she wasn't in a position, for example, where she could access a shelter, where she could leave the province, the HRM, because her children, she needed a place that could accommodate her children. I recognize this was about 5 months ago, and so perhaps it has improved, but it took us working with her almost 3 months to access the subsidy for domestic violence survivors. Fortunately, we had a unit, an empty unit we could put her in. Very awkward to have your staff person in your own housing unit, but that was the only solution we had. And so from that, we've been looking at when you have to move an entire family, it's extremely difficult. Sometimes, as has been said previous, there is access to a hotel room for your family, but you can imagine trying to bring your children to school and daycare and access your employment after something like this while living in a small hotel room can be extraordinarily difficult. And that's not even a guarantee. And so the access to immediate housing, and I really wanted to mention this idea of being nimble. One of the differences between government-funded programs and community-funded programs is the ability to work quickly at all hours of the day and to move and solve problems on the go. That is a reason to fund community organizations to do this work, because we have the capacity sometimes to operate at 9 p.m. when somebody is out of a home and find a place and work quickly to put someone in an apartment in that context. That wasn't available for us in this case, and so we had to do it off the sides of our desks because we were obviously not funded for that. I would be remiss not to recognize the core funding, the recent small but important core funding to creating communities of care, which is funded through Status of Women and is a wonderful program for survivors from Indigenous and African Nova Scotian backgrounds. But I think it's extremely important to recognize that survivors from African Nova Scotian Indigenous backgrounds are not accessing the sort of mainstream services at the same rate as everyone else. And so there needs to be expertise within communities that are core funded to provide those services and to meet the needs of individuals for their housing needs specifically from each community. So there needs to be conversations with new Canadian communities about housing needs and with African Nova Scotian communities about their housing needs and Indigenous communities, because we cannot just have a one-size-fits-all model. It just won't work. So that's a long answer to your question, which is to say, no, there is not adequate housing right now for families who are fleeing violence that is available and is nimble enough to meet the needs of someone who has come out of an emergency situation. That is currently a gap.
I recognize MLA Rankin.
Thank you for the thorough answer. And this speaks to the importance of the engagement table. And I want to thank all the providers that pushed for that last time we had a committee meeting here of health. So I want to ask the government for an update on where that is. And I was going to ask if the members were appointed yet, but I think in the introductory remarks that they're applying. So I guess I'll ask, when do we see that starting? What's the criteria used? And how much weight is being given to those with lived experience on that committee?
I recognize Associate Deputy Carroll.
Thank you for that important question, and I want to thank the witnesses and our colleagues here today. I think this is an incredibly complex issue and one that we really want to make sure that we listen and learn and act accordingly. Thank you for the question on the minister's table. So the minister's table is currently open for applications right now. Applications close on September 5th. We know that in this past June, the minister, Druin, announced the minister's table and is co-led by Minister Martin. The table actually will have up to 25 members, and those members will represent the diversity of Nova Scotia, many of which a lot of the diversity we've talked about here today. Our team has worked very closely with community to co-create the application for the minister's table, ensuring that there is going to be a diverse representation, including rural and urban representation. We know that, as we heard here today as well, issues and complexities around housing and services is happening here in Halifax, but is also happening in our rural regions across the province, and that diversity also needs to be reflected and will be reflected on the table. We've been very encouraged by the applications to date. As of today, there are close to 200 applicants who have applied to be part of the minister's table, and we've received dozens and dozens of emails of people sharing their stories and talking about the hope that this minister's table brings to them. So we're looking forward to the minister's selection of that, which will happen later in September.
I recognize MLA Rankin.
Thank you, Madam Chair. And will there be a public report and regular updates issued to ensure that there's transparency and accountability? And all limited time, so I want to slip in another one within that. Is we heard a lot about the importance of how this is impacting marginalized communities. So will there be disaggregated data used to track the impact on marginalized communities?
I recognize AD Carroll.
Thank you for that question. So with respect to accountability and transparency and data collection, part of the framework of the minister's table is both ministers and all ministers associated with the table are very focused on this being a very transparent, open, and accountable process. There will be a website that will be set up. All agendas of the table will be public, as well as summaries of the meeting. We will also be updating information on progress that's made. In addition to that, there will be sector calls after the minister's table. So those who are not part of the minister's table will still have an opportunity to participate in sector calls. And this is government's commitment to ensure that information is shared as widely as possible, and the sector continues to remain an active partner in gender-based violence as a whole in our province, a whole of society, a whole of government response. And so those sector calls will also be available, and information will be shared, including frequently asked questions, questions that are coming from the sector as a result of the minister table meetings as well.
I recognize MLA Rankin with 2 minutes.
2 minutes. Okay, I wanted to talk about the policing review. Since that came out, the government decided to propose the expansion of the RCMP in areas that have smaller police forces. So I want to ask any of the service providers, do you feel this decision from government addresses the gaps highlighted by the Mass Casualty Commission, particularly around the warning signs of intimate partner violence and lack of coordinated response of the RCMP? Any of the service providers?
Do I see anyone? I recognize Ms. Halpern.
I mean, the quick answer is no. It will not be. It will not do the job of addressing intimate partner violence in rural communities or in any of the communities in this province. Many of the individuals who have passed had not been engaged in any way with police to that time, and really having spoken again, having some intimate experiences with individuals who were family members of individuals who were killed, What I heard over and over again was a need for that family members saw signs and didn't know where to turn, but they were not going to turn to police because that would be to criminalize people that they cared about, and that was not going to be the approach they were going to take. What they indicated to me that they needed was community organizations that maybe could provide some supports in the community. For example, if you saw signs that you had concerns about things happening in your family, that you could go to ask questions of, to get support from, to identify pathways to help someone leave. But policing was never, not once, identified to us when we spoke to families that were impacted. And so I think what we're seeing is a policing response rather than a community-based response, and all of the research suggests that actually the best way to prevent violence in families is to wrap services and supports around communities to make sure people do not feel isolated, that families are not isolated, that they feel a part of community.
And that concludes the current time for the Liberal Party. We'll move now to the PC Caucus, and I would recognize MLA Timmins.
Well, it's been an emotional bit to listen to what has been happening in the past and to look at a positive future going forward, for sure. I see across the table departments and organizations that have supported people, families in domestic violence over the years, and it's very emotional. I know we all are passionate, all our colleagues, our MLAs that are here today. They look at supporting people, our residents, our constituents in the community, and it's important for us to come together. I worked in an MLA's office for many years. Previous to that, I worked with community organizations that helped youth at risk, community service clients. So again, I have personal stories and friends that went through struggles over the years. So this is very hard to listen to. But I have to say I'm quite positive moving forward with the support across the table, with the recognition and our province being leaders in taking over gender-based violence and recognizing that as a problem and starting the new division. I certainly want to welcome the new executive director. Sorry, I should have wrote the name down. Cherish Payne. Thank you for coming forward. It is going to be hard going forward, but we have a great team and the minister table as well. I had a lot of questions for the department regarding that, but you certainly answered a lot of the questions that I had. Thank you for that. If you could maybe talk a little about the mandate and a little bit further on the table itself, the minister's table, and how it's going to affect or move forward and address some of these issues that are coming and have been in the past.
I recognize Associate Deputy Carroll.
Thank you. Thank you for that question. We know that gender-based violence does not affect communities in the same way. We've heard about that this morning. We also understand that it affects communities differently, and we continue to remain committed to working with Mi'kmaq and African Nova Scotian organizations, as well as the 2S LGBTQ+ IA groups, to ensure that any services are culturally relevant. So this work in the minister's table will look at, when we're looking at the composition of the table, that is critically important. And I actually have something I'd like to share with everyone today, just to show you. I think one of the things that we're hearing is we're all equally touched and impacted by gender-based violence in this room, and we have experienced this, whether it's frontline organizations, we know somebody who's impacted by gender-based violence, and the commitment and leadership Nova Scotia has shown to this space. We've heard, there's still a lot to do, and we understand that. But since the call for the applications for the minister's table, We've had 9% of those applications have been Mi'kmaq or persons of Indigenous descent. 15% have been African Nova Scotians, or those of African descent. 11% have identified as persons of color. We have 4% of the applicants to date are newcomers, so this would be immigrants or refugees who've lived in Canada for less than 5 years. The 2S LGBTQ+ community is currently sitting at 21% of our applicants. We've got 29% of applicants who identify as a person with a disability. And we heard about that this morning as well, about the importance for persons with disabilities and their vulnerability. 7% are seniors. We know from the media, and those who've been impacted quite tragically have been seniors. With 4% are former youth, former care experienced youth. We heard Ms. Halpern speak today about some of the people that she's supported through this, as well as, you know, the involvement from a very young age around gender-based violence. 53% identify as people who've experienced violence, including human trafficking. 2% are male survivors of gender-based violence. So, you know, we have 53% who identify as victims and survivors, women or those who identify. But then 2% are male survivors of gender-based violence. And we know that this is another part of the conversation that is critically important. So you can see that, and we also have a large proportion from rural and urban communities. And what we've done to ensure not just the application is open and accessible, right, for all. You know, we've put supports in place to ensure that if someone is not able to fill out the online form, they can call in and get support through the Gender-Based Violence Division. People are able to call 211 and get support, if not from government, from a local community member that they trust, to prepare, to help them, support them through the application process. We did extensive research on even the Stats Can to ensure, like, what is the representation of Nova Scotians, as well as looking at data around, you know, who are more vulnerable who are the most vulnerable when it comes to gender-based violence. And I think you know, many of our colleagues and witnesses here today have also helped to identify a lot of that very critical, important research. So this table, a lot has gone into the thought and process to develop the table to make sure it's reflective of Nova Scotians who are experiencing gender-based violence, to ensure we continue to collaborate and listen to the voices that are frontline and on the ground and experiencing gender-based violence and the diversity that comes with that. And really it is those voices and the continued work of our communities and our government colleagues, you know, a whole of government, a whole of society approach, right? The table is posed to be a new way, a different way of working collaboratively together, and we're hopeful for that when we close the application process on September 5th.
I recognize MLA Timmins.
Well, my next question was regarding voices, and I see at the minister's table you have answered regarding the minister's table. You have provided some answers to me regarding that, so that's quite a positive step forward for sure. Multi-departments as well, are they involved in the minister's table? Could you explain a little bit about them as well?
I recognize AD Carroll.
Yes, thank you for that question. So we have the Office of New Affairs that is actively involved in the minister's table, the Office of Equity and Anti-Racism. We also have the Status of Women, who is co-leading, of course, with our minister at the Department of Justice. We have the Department of Health and Wellness. We have Opportunities in Social Development. We have Early Childhood Education. We have the Department of Health and Wellness, Office of Addictions and Mental Health, and we also have ANSA, which is African Nova Scotia Affairs. So, and although those departments and ministers are have been identified, I want to assure everyone that all of the ministers and all of government is quite committed to this table. And should there be a need for other delegates or other ministers to come to the table during agenda priority items that may come up by the members once the table is launched, then those ministers are also committed, and those departments are committed to supporting the table as well. So, and the first meeting will be held in October.
I recognize MLA Timmons.
Thank you. I'm going to pass on. I know my colleagues have some questions that they would like to ask, but I want to thank everyone for doing this collaborative approach and moving forward to help with the issues that we've been dealing with for many years. And I know housing has been an issue, and we see some development that's happening down the road for that as well. So I'm quite pleased with that. Thank you.
I recognize MLA McGowan.
Thank you. And I'd like to add my voice to what's been said here today, how grateful we are for each of you being here, sharing your voice, sharing your expertise, both government and providers that are here. It's a heavy topic and it's important, and so thank you for being here today. I do have a couple of questions. So for the Associate Deputy Minister for Nova Scotia Advisory Council on the Status of Women, so we know that the sector has been asking for more resources, and recently the government has responded with significant funding increases. Could you talk about and walk us through the process that led to the timing of that decision?
I recognize AD Johnson-Morrison.
Thank you, Madam Chair. Thank you for the question. So when it comes to funding, I think it's important to acknowledge that funding is one part of this issue, but it's not the only part. This is an issue that is in all of society issue, and it has been, gender-based violence has been an issue this year. It was an issue last year. It was an issue the year before that. We have been living with this as a scourge within Nova Scotia and within all of Canada, and perhaps globally for a long time. So in terms of the way in which we have structured the response for funding to this issue was to really focus on trying to have an all-of-government response. So all the departments across government collectively have been involved in supporting the $103 million investment that government has put into this issue. In addition to that, the additional funding that you spoke of, when we heard from the sector in the spring of this year, they expressed that even after the historic investments, which was $7.7 million on top of the additional investment that was made, which was historic, it was the highest in decades, brought that investment up to $17.8 million. Once we heard from the sector that there was additional need for issues around wages and issues around stabilization, an additional $17.9 million was provided, and this was specifically just to the transition houses. So in partnership with conversations with THANS, we were grateful for their insights to tell us what exactly they needed, so that stabilization funding was added on top of the historic funding that was provided to the sector. In addition to that, there are other areas where work is needed. We've been talking a little bit about housing, and one of the areas that we have actually provided additional funding was to the YWCA. They have two great programs, and I would certainly encourage that my colleagues that are here that can speak to them, both the December 6th Fund, which provides funding specifically for anyone that's fleeing gender-based violence, and the Safer Spaces Fund, and that one is for anyone who has been an unfortunate victim of trafficking, and that is actual supports to allow people to stay in a safe space and transition as they rebuild their lives. So those are some of the pieces that we have actually done as departments in ensuring that we are actually collectively finding ways to support this issue. And I think as we're talking a little bit about this, and I don't want to miss the opportunity to say, we also have pieces around housing here. I know my colleagues here from Adsum, where we are actually supporting projects like The Rose, which is a beautiful space, and I would encourage anyone who has not actually had a chance to tour it to reach out to Adsum and ask about it. And it supports women and families, so women and their children. It's a safe space for them, and this is additional supply that that the Department of Opportunities and Social Development was able to provide into supportive housing for women and their children just this year as well. So when it comes to approaching this issue, it is an epidemic, but we are also coming at this from an epidemic response whereby all departments are locking arms, finding ways to find solutions, whether it comes to housing, whether it comes to creative solutions. And I was pleased to hear that my colleague Emma mentioned about the creating communities of care. For the first time ever, that program was actually able to be core funded this year. We've provided core funding to that, so that's now going to be something that supports Indigenous communities and African Nova Scotian communities into the foreseeable future because the funding is now core. So thank you for the question.
I recognize MLA McGowan.
And thank you for a thorough answer. I'd like to also ask, although funding is an important in addressing gender-based violence, we also recognize that other efforts are just as critical in making a real difference for survivors and communities. Beyond funding, what other steps are being taken to strengthen prevention and improve support for those affected by gender-based violence?
I recognize AD Johnson-Morrison.
Thank you for the question. So I think I started to speak about some of them. There are lots of things that we're doing, whether it's with the Mi'kmaq Native Friendship Society Association, whether it's with creating communities of care, as well as guys' work. There's so much of areas that we've been working on, and we've been working in these areas because we understand that supporting issues around gender-based violence is multifaceted. So it takes men, it takes women. It really is ensuring that all pieces of the puzzle are actually cooperating to support and address this issue. And coming out of the mass casualty, we know that recommendation C-17 did also call very specifically for us to respond differently when it came to ensuring that youths were also very early exposed to issues, how to combat gender-based violence. So one of the things that we are incredibly proud of that this collective is having when it comes to all of the departments speaking to each other is ensuring that through the Mass Casualty Commission conversations that we're having and the DFI conversations, we're collectively supporting the introduction of curriculum into the schools, and that will be rolled out in the foreseeable future. And that's curriculum that's focused specifically on gender-based violence. And in addition to that, we are supporting things like Guys Work, which is now in 60 schools and it's permanent programming. So, these are important steps that in addition to programming that we're doing, we are also finding ways to ensure that a number of different parts of society are also taking up their space in this work. So I think when it comes to issues around funding, yes, that is important, but there's lots of other areas in which we're continuing to support and address and really roll out programming to ensure that it's culturally competent. It really is reflective of the societies that we serve, and it really does allow for us to hear from the colleagues who are actually doing this work on the front lines that are coming forward to tell us, yes, we would like to see more expansion of programs like the December 6th, to which we were able to provide funding, or things like Safer Spaces. Any of that is what forms the collective of how we can respond positively to the need in this sector. Thank you.
Further question?
I just have one other.
Sorry, I recognize MLA McGowan.
Yeah, just one other thought. For our folks that are not part of government, for our service providers that are here, I'm just wondering if somebody could speak to what you see as something that would have particularly strong impact other than the funding. Beyond funding, what would have the most impact?
I recognize Dr. Hansford.
I think that's a great question because funding is hugely important, and we need to be looking at what is epidemic level funding, right? And having that question. However, there's lots of things that we can start doing in government to be able to move the mark urgently that doesn't require funding. So some of those things would be even looking at the bill and the act and looking at the exclusionary language actually of intimate partner violence and looking at other forms and other language, so gender-based violence, changing the terminology and kind of re-examining that. Looking at current policy and legislation that's in place right now and having a little audit of what that means with a gender-based analysis, having training for government officials around what this is, how to address it, and when we're looking through a gender-based violence and inclusionary lens in the work that is happening in government daily. We can look at Guy's work, fantastic program, starts in grade 9. Brains and education, early education is critical and vital, and boys and girls are intelligent and resilient, and we can start those conversations a lot earlier and have some impact there. And finally, when we're looking at ways that we can make impact, I think we really need to be looking at communication between the family courts and the criminal courts and our justice system, and how that's responding to families and women and gender diverse individuals who are going through the court system, and how that continues to be abusive and oppressive and doesn't provide safety. So those are other avenues that we can look at, that doesn't require big price tags.
I recognize Ms. Halpern.
Thank you for the question. I would really recommend a review of the Provincial Victim Services Program. Again, that doesn't require funding, but it is. We did a study that was funded by Wage a number of years ago, where we talked to survivors about their experiences going through the system, and over and over again, from every single survivor that we spoke to, they felt failed by the Victim Services Program. I don't blame the individuals who are doing the work. I think they have large caseloads, and it's very challenging work. So this is by no means to point out any individuals, but really, is that funding going to actually supporting survivors? And what would survivors say they require? Is it phone calls and letters, or is it something much more robust that's required? And so that's an area that we at our organization have been calling for some overhaul to for a number of years, and would like to see a review. Thanks.
I would recognize Ms. Pringle.
Thank you very much. I would like to add just a few comments about prevention strategies that we haven't heard yet today, and working with my colleagues, men who work with men who have victimized. I think it's very important that we have mental health clinics in our communities, so that when red flags are identified early on, that there's a place for people to seek support, and for people to go and seek support. There is a cycle of victim as child, victimizer as adult, and it's important to interrupt that cycle in the prevention of gender-based violence. And until we have appropriate amount of mental health clinics in our communities, it is very unlikely that we will stop this cycle. So that is an area for prevention. It's not an area that the YWCA works in, but it is an area that I think is very important. And my colleagues Robert Seymour Wright and James Dubé, James of the People's Counseling Clinic, and Robert is now faculty at St. Mary's University, have wonderful ideas in terms of mental health supports, and they've been treating people who have caused victimization, and also men who have been victimized themselves as well. And their strategies are effective, and they work, and they get results, and I'd like to see their ideas in terms of mental health support spread around the province. I'll also just add a comment about response and directly to the YWCA Halifax, with our Chief Executive Officer, Mia, has made great inroads into affordable housing, and with opening 32 units of Mount Hope in 2004, and opening another 17 units, 3-bedroom units, and another 17 2-bedroom units this fall in Mount Hope. So increasing that government, private sector, community-based organization, not-for-profit collaboration to open the affordable housing. People come from the by name list. They have experienced houselessness. A lot of people have experienced gender-based violence, and these are really important strategies for providing safe support and access to amenities for people. So thank you.
And I would also recognize Ms. Desinquoy.
Thank you. I just wanted to add a few comments. And in response to your question, I think something that doesn't require additional funding that we can implement today is using the newly created ministers table as the engine and the new GBV division. I think what we can do to make this different is rather than use it to collect another set of recommendations that sit on a shelf and collect dust, give the appropriate government departments authority and to take Ms. Halpern's language nimbleness to implement them. I think the last thing that we need is another opportunity for survivors to share what they've experienced and to be left feeling disappointed that no change has been implemented. And very quickly, a note on funding. I will say our request for additional funding started in 2019 in response to a report that we put out called the Models of Service Report. So it took some time to get that additional funding. And I will say as well, transition houses are some of the only community-based organizations other than women's centers that I'm aware of that have an umbrella association that can advocate on their behalf. I will note that I may be one of the only service providers sitting here today that doesn't provide frontline services myself. So I have the time to come here and talk to you today. I recognize that my colleagues don't have that time and don't have the benefit of having that umbrella association. I think that is key because it takes a lot of time and effort to advocate on behalf of a community organization. And I will also say that the additional funding that was granted was very appreciated and needed. It is on a 4-year term. So after 4 years, we will find ourselves in the same situation that we were in earlier this year. And I don't think that that would be considered stability. I think we need funding that we can rely on year to year rather than going through this cycle every 2, 3, 4 years. Thank you.
I recognize MLA Macquarie with about 4 minutes.
That's not long enough. First of all, I just want to acknowledge what a great job you did today at describing the needs with well-reasoned and compelling information in such an emotionally charged issue. And so I really appreciate that. One of the things that I've heard that resounded with me is the exit strategy, that this is something that is incredibly important. I don't know if you're going to have enough time to answer this question, but I see before me people representing various stages of not just an exit strategy, but rebuilding somebody's life. And I was wondering, you know, we really see the needs and needs for improvement, but could you tell me, like, with all these, have so many people working so hard, could you tell me about what a successful incident looks like where someone is living in a violent situation and accesses your support and rebuilds their life? What does that look like for you? Who starts? Probably you. Yeah, thank you.
So I recognize Ms. Desinquoy.
So I think success in this circumstance would be someone reaching out for support. We know that many people don't, either because they're living in fear or because they don't know that transition houses or other supports exist. So I think it's our job to ensure that everyone knows that there is somewhere that they can turn to for support and to actually reach out. What we know is that it can take up to 7 attempts before someone is able to successfully leave an abusive relationship. So that in itself, being able to leave is a measure of success. I think in this situation, again, it would be being able to accommodate someone immediately. So someone is fleeing, there's no wait list for a transition house, there's no wait list to get access to programming. They're able to immediately access the support they need, and then from there, we're able to accommodate their needs and direct them to the appropriate resources, again, without wait lists or without confusion. One thing I'm hearing from the front lines is, even for those who are well-versed in the systems, who do this quite literally for a living, it's difficult to navigate all of the different systems. You need an advocate, and unfortunately, not everyone who's experiencing violence will reach out. Not everyone who's experiencing violence has an advocate. So I think being able to access the support you need without barriers, without delays, is what success can look like. And then moving out of the temporary emergency shelter, communal living is not meant to be a long-term solution. So moving into safe, affordable housing, finding employment, being able to navigate the court system and not being re-traumatized, these are some measures of what success can look like, and I will turn it over to my colleagues to share.
I recognize Ms. Halpern with 28 seconds.
The only pieces around children, there needs to be a recognition that because you're a survivor of domestic violence, does not make you an unfit parent, and there needs to be services to support families to stay together, and for Child Protective Services to offer some supports rather than simply be a threat to take away children.
Thank you. And with just seconds on the clock, I think it's best that we move into providing an opportunity to all our witnesses for closing remarks. And again, I will just leave it at my sincere thanks so as to maximize our time with you this morning. I would recognize Dr. Hansford, if you'd like to provide closing remarks.
We're fortunate as an organization. We have incredible support from generous donors and community members, and constantly apply for grants and opportunities. If change is going to happen, this pattern cannot continue. Adsum, like many organizations also present here today, subsidize government in their responsibility to fulfill basic rights to Nova Scotian women and children, rights such as safety and housing. Adequate core funding coupled with consistent evaluation frameworks will enable community organizations like ours not only to be sustainable, but enable us to think and direct our time, energy, and resources to innovation, to alternative responses, and to housing. Too much time is lost in grant applications, which instead could be redirected towards client services and the sector. And my colleague from EFRI has highlighted the importance of the nimbleness in this. Additionally, the gendered pay gap cannot go ignored when planning an epidemic-level response if we want it to be truly successful. The gender-based violence sector, like many other care-based and community services, are staffed predominantly by women. Despite carrying critical expertise and responsibility for public safety and well-being, these professionals remain underpaid in our province. Nonprofit workers who form the backbone of this crisis response, as we heard today, around intervention and prevention, are reporting record levels of stress, burnout, declining health as their wages fail to keep pace with the rising cost of living. Without urgent investment and fair compensation and workforce sustainability, our frontline response capacity will remain at risk. This is a really real example for us. We lose many excellent social workers and other professionals to government and healthcare because we don't have parity. For example, with hospital social workers and pay, we don't even actually have parity with THANs, and we're doing the exact same work in community. And finally, just to talk about exit strategies, and something we didn't get to talk about today, is that not everyone wants to leave. We need to also really look at early intervention. We need to look at restorative practices with families, and really engage in community supports. In community, not necessarily everyone is leaving. EFRI has an excellent example of practice around family-centered supports for families going through the child protection system and through the law courts. That is a best practice example that we can draw from and build on. Recent studies on adverse childhood experiences have shown that multiple stressors that result from family violence can have short and long-term adverse effects on a child's neurobiological makeup, cognitive ability, education, attachment, physical and mental health, as well as their ability to manage stressors as a result. This is the piece that we are missing. We cannot forget the impacts on children and the next generation. And this should absolutely be a consideration when we're planning our epidemic level response. As a sector, we've heard today, we are continuing to do all that we can within our power. Although there has been record investments, these are still falling very short of what is needed for sustainability, let alone innovation and the system overhaul that we need. Our briefing kind of highlights that. The reality is that some of us on this panel have lived, that 1 in 4 women in this province have experienced, and is the reality that we're facing in community every day. It's hard to maintain and offer hope when people reach out for help and there's nowhere to go, no access to mental health, no cultural supports that understand the unique complexities of their family situation and their community. I could go on. What we are missing is the urgency. So I ask you today, here, the committee, what concrete action, what next step are you taking forward? Because we're not just here to listen, we're here to act. Thank you.
I would recognize Ms. McHugh.
It's a reminder that gender-based violence is not inevitable, it is preventable. But prevention requires us to treat this epidemic as it has become with the same urgency, scale, and coordination as any other public health crisis. This means embedding equity and inclusion at the core of our strategies, investing in prevention alongside crisis response, and removing systematic and bureaucratic barriers that delay safety. Nova Scotia has already shown leadership with targeted epidemic-level response, and so by doing so, we will not only save lives, but also create stronger, safer, and more resilient communities across our province. Thanks.
Thank you. I recognize AD Carroll.
Thank you, Madam Chair, and thank you to the members of the committee for your thoughtful engagement today. As we close, I want to reaffirm that government is taking meaningful action on many fronts to address gender-based violence. We are investing in services, strengthening our programs, and building new structures that reflect urgency and the complexity of this issue. We are making progress, and there will be more work to do. There is a growing sense of momentum as our coordinated cross-government whole-of-society response continues to take shape. From the courage of survivors in sharing their stories to the advocacy of frontline organizations and the stories we heard here today, as well as the creation of the Minister's Table, we are seeing new and different opportunities for collaboration, innovation, and impact, and these are all critically important. The Department of Justice remains deeply committed to this work. We will continue to focus our efforts and investments in the area that make the most difference, and we will keep listening, learning, and acting alongside those who are leading change in their communities. To the committee and to the survivors, community members, and the frontline service organizations who show up so fully and with such dedication, thank you. Your leadership and your commitment to a better future are truly the foundation of this important work. Government looks forward to our continued collaboration to achieve a better future together. Thank you.
Thank you. I recognize AD Johnson-Morrison.
Thank you, Madam Chair. I want to start off by saying a deep thank you to all the committee members who appeared here today. I recognize that what you have shared could not have been easy, but I would like you to know that we remain really committed to working hand in hand with you to ensure that your voices are elevated and reflected in the systemic changes that are underway. The table that was referenced by my colleague, ADM Carroll, is going to be one of those mechanisms by which we will take the important steps that are needed to try to ensure that First Voice is really embedded in the change that's needed. We have made a lot of successes, and it's really has been in part to a lot of the things that you have brought forward. And I believe that the commitment to this table and the commitment to the work that we're doing around advancing the eradication eradication of gender-based violence will be more meaningful because of your voice that will be there. So thank you, and I look forward to seeing as many of you as possible on that table. That will help us to change the story that Nova Scotia has right now. We certainly want to see a better Nova Scotia, and I appreciate you all sharing your comments today. Thank you.
I recognize Ms. Halpern.
Thank you. As you heard today, there's tremendous expertise in our communities. We know what the solutions are. We know where the gaps are. We know what the problems are. I had a staff member go through the multitude of reports in Canada and in this province on domestic and gender-based violence over the last number of years, and there are literally already hundreds and hundreds of recommendations that remain to be implemented. So my lasting comment is just, I am optimistic about the minister's table, but I cannot further second, any more vehemently second my colleagues' comments that this cannot be yet another time where we just talk about the problems and write another report. People are tired. We're tired. These were 3 of my staff were impacted by gender-based violence. This isn't my clients. Like, this is everywhere around us. It is time to act. It is not time to talk anymore. We know what to do. We have the expertise in this room today. We just need to actually do it. And those are my comments.
I recognize Ms. Delacroix.
Thank you for the opportunity to speak today. I'm going to echo the comments made by my colleagues. I think the answer to the question, what does an epidemic level response to gender-based violence look like, is sitting here as part of this panel, is found in community, it's found within survivors. We know what needs to be done. We know, we have the knowledge, the expertise, we know what tools need to be implemented, and now we just need to do the work. We have the MCC report, the Tracadie inquiry report, the Missing and Murdered Indigenous Women's report. We have various roadmaps. We know what needs to be done. And those working at the front lines and survivors themselves have had to be extremely resilient and creative in finding solutions and in having their needs met. And they shouldn't have to. So to reiterate my earlier asks, we need to stabilize the frontline response, we need to invest in prevention and culture change, and we need to expand supports for those who cause harm. And I also remain, I'm encouraged by the minister's table, and I think if we use this appropriately as an engine, we can truly make a difference here in the province. Thank you.
I recognize Ms. States.
Okay. Thank you, Madam Chair and the House Committee, for having me here today. As we close today, I want to remind us that intimate partner violence is not just a personal tragedy, it is a public emergency. In Halifax and across our province, women are dying at epidemic levels. And when we say we need epidemic level response, we are saying that our lives matter enough for urgent, coordinated, and collaborative response. Urgency is needed here. Investments in culturally grounded supports, shelters, mental health clinics, housing are what are needed. As a prevention for programs, we want them to acknowledge, educate, and address stability for these supports. We cannot separate the violence in our homes from the inequities in systems. To end the cycle, we must confront both of them. We must empower survivors, resource families, and create safe spaces where our children can grow free of fear. But we are not only defined by struggle, and we are also defined by resilience. African Nova Scotian communities have always found ways to survive, to love, and rebuild. That same resilience must now fuel us to demand more and to act boldly and to ensure that no woman, no child, no family is left behind in silence or in shame. Let us respond to intimate partner violence with the urgency, resources, and compassion it demands. Our future generations deserve nothing less. Thank you.
And Ms. Pringle.
Thank you very much, Madam Chair, and thank you very much, House Committee, for having me here today. I'm just going to speak off the top of my head in my closing comments. I have grown up in rural Nova Scotia. My father was a United Church minister, and so my life and history is in around this province, from Cape Breton to the Eastern Shore to Hants County, to Cumberland County, to Lunenburg County, to Halifax. And one thing I can say about growing up, being the child of a minister in rural communities where there are next to no resources, especially in the late 70s and early 80s and the 90s, is that we have a beautiful province and many beautiful people and a violent underbelly. And I have been aware of this since I was 5 years old, when going to the Walton General Store with my mother, and a woman walked in from across the street who had been beaten so badly that there was next to no skin that was not black and blue around her eyes and down the side of her face. It turned out that her husband had beat her, and on the walk home, somewhere between the Walton Fire Department and the Walton Cemetery, I had a conversation with my mother about this situation. And my mother said that she had been beaten by her husband. And then I said, and what happened to the husband? And my mother said, the teenage son beat him back. So this cycle of violence that we have in our communities has continued on for decades. And I'd like to see it stop after all these years. And so as cranes keep going into the sky in our province, we no longer can claim, with the narrative that I grew up with, is that we were an economic backwater. We suffered from century-periphery relations with the seat of power in Ottawa, and this is really the lot that we had in life. But we know that this economic tide is turning in our province and in our country, and I would like to see us with upfront investment in our people, particularly the people who are experiencing circumstances beyond their control. So that looks at, in terms of prevention, that we get the mental health clinics going. I think this is a very important piece. That we invest in our affordable housing as a response piece, that we invest in our education, and that we invest in the income of our people with disabilities and people that are being disabled, and that people who are experiencing extreme abject poverty. Thank you very much. It's been a great privilege to be here.
Thank you. That concludes. I would dismiss our witnesses again with sincere thanks. Can we keep it to a 3-minute break? We have only one item of business, or shall we'll just move right in, give our witnesses a moment to, I suspect many of us would like to speak further, so as the witnesses head out, we will take an opportunity to speak to you further outside the chamber. Thank you. We really only have the one piece of business, which was the response to additional information that was requested from Build Nova Scotia at our June 3rd meeting. That information has been received, and I would only be asking members if there is any discussion on that information. I would also like agreement if the information can be uploaded to the legislature website. Is there any discussion? By a nod of heads, can we agree that the information should be added to the website? Thank you. Given that the legislature will be resuming on the 23rd of this month, and that this committee will not be sitting while the House sits, we will convene at a date to be announced, and I believe the topic as well to be announced. Hard to pin down witnesses until that time. With no further business, this meeting is adjourned.